Welkin empowers health organizations to deliver patient-centered care. Welkin is purpose-built specifically for healthcare organizations. Some key differences you'll see from other tools used for patient management are configurability, patient centricity, extensibility, and workflow automation that enables more human caregiving. In this video, we'll focus on Welkin's care delivery portal, where the care team would spend their time. At our clinic, we aim to reduce hospitalizations and ER visits and connect patients to services they need to help them make positive lifestyle changes that will improve their overall health. We coordinate across a care team to provide seamless patient care from the time a patient first comes into our clinic throughout their entire journey. When Miguel, who is an MA at our clinic, logs in, he lands in his inbox, which is a collection of personalized tasks he needs to complete today. These tasks keep him focused on what he needs to do for our patients, whether they've assigned them for themselves, or they've come from our team, or automation rules and triggers, such as the intake form completion. These tasks are grouped by categories that are unique to our program, patients, and the type of care we need to deliver. The inbox categories and additional information that is displayed were configured by Patricia, our program director, so that Miguel has an at-a-glance summary that helps him understand what he needs to accomplish. Ali is new to our clinic and is being seen for cardiopulmonary disease. When he arrives, Miguel completes an intake form on an iPad with Ali. When Miguel submits the intake form, Ali's patient profile is created. After he is checked in, Miguel completes an ACE assessment, data we're collecting for a research project. This helps us determine how Ali's past may contribute to his long-term health risks. Finally, Miguel completes a social determinants of health assessment with Ali, which indicates that Ali has food insecurity and housing instability. The information Miguel fills out will be centralized in this patient profile and visible to Ali's care team, with his particular risks listed in a sidebar that stores data from integrations such as an EMR, manual inputs, and any patient summaries that need to be easily viewable and readily available for Ali's care team. Future interactions, assessments, and data from other systems integrated with our care delivery portal will also be visible in Ali's individual patient profile over the course of his time in our care. Based on the information Miguel collects, an automated process determines that Ali is an at-risk patient who could potentially drop out of our program early and will require additional care and support outside of his medical check-ins. That designation then triggers another automated process that adds a high-risk care plan to Ali's profile. This care plan can be tailored to fit Ali's specific needs and will coordinate his care across his care team, including any other MAs or care coordinators or NPs that interact with him. An alert is also created for those team members to review to ensure everyone is on the same page. When Ali's visit is finished, we can disposition the visit to indicate it was completed and select the appropriate billing code. This code is then used to automatically generate a claim for the visit through an integration with Welkin. We also make a referral to Meals on Wheels to help with Ali's food insecurity. Fast forward a few months, and Ali has been in our care plan, making visits to our clinic at regular intervals. In between visits, automated texts send reminders about upcoming appointments, additional texts with surveys or educational materials to keep Ali motivated to stay in our program and continue making healthy changes. Ali has also been filling out quality of life assessments each time he visits our clinic, and we can track his reported unhealthy days through a report that displays his results over time. These raw assessments are also visible in his timeline, which is a history of interactions. Miguel gets an alert if Ali misses an appointment. Ali has missed his last 2 appointments, which trigger an alert to Carlene, Ali's care coordinator, so she can reach out. She can contact Ali through his preferred channel, SMS message, with a message that she composes, or using a template as a starting point. In the relationships portion of Ali's profile, Carlene can also see anyone in Ali's life who she might have to coordinate care with, including his partner. Since we have an ROI with his partner Janice, we can also reach out to her if Ali doesn't respond. As our care team continues working with the various patients coming in, Maya, our medical director, can review the efficacy of our care and caseload management using Welkin's dashboards. They can see patients within each phase of care, the progress of patients' various health assessment scores over their patient journey, and drop-offs in patient engagement. Our team can also export the data we need to provide required metrics back to government and regulatory agencies. The customized patient profile, automated workflows, and my personalized inbox were created once by our program director in workshop, but they can be reused across the entire care team. As we continue to learn what works best for patients in our programs, we can give that feedback to the program director, and they can use built-in analytics to easily iterate and roll out updates. Over time, we know this will empower us to deliver the best patient experiences and highest standard of care.